Thank you all for joining us today for the Hopkins at Home series, Being Other. Thanks to Michael, Will, and Vicki from Hopkins at Home for all of the preparations for this event, and Tony for his amazing technical support. Also, a special thanks to my colleague, Elena Thompson from the Office of Alumni Relations for inviting me to join this series. The series is sponsored by Peabody, JHAA Affinity, Hopkins at Home, and the Office of Diversity and Inclusion. My name is Katrina Caldwell, and I have the pleasure of serving as the Vice Provost for Diversity and Inclusion and Chief Diversity Officer here at Hopkins University, and also as your moderator for what I know will be an impactful conversation with two members of our alumni community that we are featuring tonight. A little bit about the Hopkins at Home series. 2020 brought us more than a pandemic, and during this unprecedented time, many existing issues of inequity, identity, and intersectionality have risen to the surface, for some in different ways, and for others for the first time. These discussions have been created to offer an opportunity to share experiences, to learn with one another, and to have frank, open, and respectful conversations with Johns Hopkins as our connection. Our alum for the day represent our American Indian, Native, community, and in respect of that relationship and that connection, we felt that it was appropriate for us to start this event with a land acknowledgement. Many of you know that land acknowledgements have been put in place at institutions and organizations and events to acknowledge the specific sacrifices that Indigenous peoples have made and their continued significance as a part of our community. Our land acknowledgement is we humbly acknowledge that Johns Hopkins University is located on the traditional and contemporary homelands of Indigenous people. Our campus resides on unceded lands of the Piscataway and Susquehannock peoples. We recognize the enduring presence of more than 7,000 Indigenous peoples in Baltimore City, including Piscataway and Lumbee and Eastern Band and the Eastern Band of Cherokee community members. As we gather from places across this country and around the world, we honor and recognize the Indigenous people of our homelands. Together, we acknowledge the history of genocide and ongoing systemic inequities while respecting treaties made on this territory as a step towards reconciliation and strengthening relationships and partnerships with Indigenous peoples and their communities. We give thanks to the past, present, and future stewards of this land and respect all tribal nation sovereignty and right to self-determination. We aim to hold ourselves and the university community accountable to tribal nations. I want to acknowledge the fact that our panelists today have come to share parts of their stories and their histories. I want to also acknowledge that I'm an ally and advocate of this space, that I am not a member of this community. And so I want to thank them for giving me the opportunity to join them in this very important conversation. With that, I'm going to introduce our panelists. So today we have Dr. Joshua D. Allison Burbank. Dr. Allison Burbank received his master's and doctoral degrees from the University of Kansas, where he focused on neurodevelopmental disabilities and prevention research. He has a public health training certificate in American Indian Health from Johns Hopkins University. He attended the University of New Mexico, where he received a BA in Speech and Hearing Sciences. Dr. Allison Burbank has held several leadership positions recently, including Vice Chair of the Multicultural Communities within the Association of University Centers on Disabilities and co-chair of the Native American Caucus within the American Speech Language Hearing Association. Dr. Allison Burbank is based at the Johns Hopkins office in Albuquerque, New Mexico. Our second panelist, Jennifer Parisian, is a member of the Turtle Mountain Band of Chippewa Indians. Jennifer is a graduate of Minnesota State University with a bachelor's in finance and holds a master's in finance from the Carey Business School at Johns Hopkins. She is currently a relationship manager at FS Advisors, a Native American-owned financial advisory firm where her primary role is to assist tribal governments with project development, grant management, and strengthening financial management. Prior to serving in this capacity, Jennifer was a legislative policy analyst at the Native American Finance Officers Association, where she advocated for tribal inclusion in the areas of accounting, finance, and economic development. I began our conversation with this opening question, and I'll start with Jennifer. Being a member of the Native American community in X means what to you?
Thank you. And before I answer that, I just really want to thank Hopkins at Home and thank Elena for inviting me to be a part of this panel. This is a great opportunity for both Dr. Allison Burbank and myself to share Native American history, our points of view in this, especially as it's the last day of the month and President Biden had declared November as Native American History Month. So just want to thank you all for giving us this opportunity to be a part of this engaging conversation. Being a Native American in my area, which is finance, what that means to me is I'm able to use a lot of the skills I learned at Carey Business School to really better our people. The tagline of the university is business with humanity in mind, and that I think has really aligned with the cultural values that I share in using the finance and the nerdy economic skills that I have to really help better our people. So for me, what that means to me is helping tribes strengthen their financial management, whether that is helping them get financing for projects, helping with, as my bio said, grants management or other opportunities, which I think helps with other things, helps promote them carrying out essential government functions. And with this question, I do want to use this opportunity to help educate those that might be on our Zoom, is that it is very difficult for tribal governments to strengthen their financial management because of policies that have been put in place through the federal government that kind of stump and create challenges. Some of those being that although tribes are located on reservations, the land is not theirs. And so tribes can't charge taxes like the local government could. And without the ability to charge property tax and those things, our abilities to carry out police, water, safety, schools, and to get money to do that is really limited and challenging. So for me, using those skills to help ensure the public safety of the governments that I work with, I'm really proud of that, and I'm proud to be part of the Hopkins alumni. Yeah.
Thank you. We're going to go with first names. Joshua, you okay with that?
That's fine.
Okay. So the question, being a member of the Native American community in X context means what to you?
Yeah, first, thank you for allowing me this space. I want to kind of extend my introductions to make sure I'm doing everything in the right way. She'e Joshua Allison Burbank, Shia, Kugan Nishle, Kis Ani Bashchi, Tohana Dashache, Kis Ani Dashanella, Akut Ego Dene, Do Kis Ani Hustin Nishle. And I think that's how I answer that question, is as I think about the intersection between my culture, my language, and then also our traditional ways, and then the public health ways that I've learned from my public health training there at Hopkins and schooling at the University of Kansas. I think that's how I answer that question. It's about what I know and what I grew up with in regards to community and kinship, and then also how that intersects with models of health and well-being. And then the schooling comes in and helps me to put these into action, at least in from the public health realm. And so I come to you from a public health lens, because that's where my post is in the Bloomberg School of what is my role as an Indigenous researcher, Indigenous teacher to how do I blend those? And I think that's what that means when to answer that question of it means that I'm able to navigate both those paths, and I'm able to combine and understand that intersection when it comes to implementing the science or the research or the teaching. And so I'm just constantly thinking about, again, that intersection of historical events, things that happened some time ago, and the things we encounter today: racism, discrimination, continued colonization, and acts of genocide. What do we do at that intersection? How do we help improve communities and well-being? And so that's the best answer I have, is I am constantly walking at that intersection and figuring out, how do I do this work, or how do I use what I grew up with, but also how do I use the academic training to put things into action? And in my case, it's trauma research, COVID recovery, helping my tribe and other tribal nations here in the Southwest to think about next steps as a result of the pandemic, and other public health initiatives that I've been a part of, and my center at the American Indian Health has been a part of too over the past years.
Wonderful. Thank you so much for sharing, both of you, that you put into practice, right? What are some of the things that you've learned? But I love that concept of the intersections, and thinking about at those intersections, how do you continue to contribute and empower the communities of which you're both very much a part of, and committed to helping move the initiatives and the needs forward for those communities. I'll start with, I'll go back, I'll build on, Joshua, what you were just sharing about your work in the health system or health disparities. It took some time for the nation to focus on the impact of COVID on Indigenous Native American communities. What is the cost of that kind of delay? What is the impact that has on those on the communities?
Yeah, that's an interesting question to think about as we move forward in recovery efforts and continued preparation and precautions that are in place across Indian country. But I think what we saw early on in the early surges of the pandemic last year was the vulnerability that we have known all along that existed in Indigenous communities. The healthcare infrastructure, the way the schools are set up, and across all areas, we can probably identify some type of inequity that was already there, but it multiplied when COVID entered these communities and snuck in. And so when I think about the response, which was very, there was a response not just from the community down to the grassroots and mutual aid level, but other folks stepped up. The Center for American Indian Health, Johns Hopkins, and Indian Health Service, other people stepped up. But I think that action was needed decades ago, where we drew and recognized the need to help address those inequities that are already there, to help improve the infrastructure. And so I think all this is lessons learned, not just of the vulnerabilities of Indigenous communities, but also the strengths and the resilience that these communities have, that despite being hit hard by the Saigi, which is coughing sickness in Navajo language, which is what means COVID. When that came in, we were able to still be resilient and still push back and fight back against this virus. And so I think it's a call to action, but from what we've seen from the Navajo Nation to the Dakotas and other urban Native communities, that getting healthcare, especially prevention services to these communities is a challenge because of all those layered systems and all these factors that are very political. And so I think in regards to Indian health, and also really thinking about community-based participatory research methods, I think we really have to take a step back and look at what can we be doing to address those systemic factors. If we're doing research in early childhood, if we're doing research in epidemiology, we can continue that science, but also let's think bigger. What else is contributing to the high incidence of chronic diseases, or what's contributing to that lack of kindergarten readiness that Native children experience? And so this is my call to action for all of us in working in public health and across the schools at Johns Hopkins, to be thinking about that humanity factor of how do we meet at empathy when working with diverse communities to bring about change, to change the way we're doing stuff with the goal of addressing health inequity.
Thank you so much. Jen, also the economic piece of COVID. It had an impact on the economic strength of communities' abilities to navigate already, as you described in your opening, in ways that it is already complex. How did COVID have an additional impact or create additional burden?
Thank you. This past year and still today, I helped my tribe use their COVID federal funds, CARES Act and other funding to look at all the resources possible, to look at ways to prepare, prevent, and recover from COVID. And some of the things that are not directly related to COVID really did impact us. We did not have reliable broadband and internet, for an example. And so when the schools shut down, students did not have a way to do online school. Even our tribal college, we didn't know that most of the tribal college students were using the tribal college as a source of internet. So that was a really big challenge. And we're very rural on the border of Canada and North Dakota. So we weren't prepared for that, and weren't prepared to have our government workers working from home. We didn't have work from home policies. Again, going back to the reliable internet, and lots of us in urban areas take for granted how important that is. We also weren't prepared for our schools shutting down, and we knew that our schools, they provide education to our students, but in a lot of ways, they also provided safety. I didn't know that our schools were doing laundry for students, providing meals for our students. And we had a whole host of issues happen without the schools open, like we had a head lice outbreak because the school nurses provided those services to students where there was no schools, and some parents just couldn't afford those kinds of treatment. I think our tribal leadership at Turtle Mountain did an awesome job being sure that measures were put in place to help our local entrepreneurs, to be sure our tribal economy still stayed thriving by creating programs to help keep people employed, because we already have a low number of jobs available. So those jobs that were there, we wanted to ensure that our local tribal member-owned businesses stayed open, and they stayed open safely. So, they're just an important part of the tribal economy. They provide us haircuts, they provide us our electrical work, our plumbing, all of these things. And we knew that our tribal leadership knew that in order to keep our economy thriving, they had to create measures and programs very similar, like the city of Baltimore put in place for small business support programs. So I'm proud of them for doing that.
Thank you so much for that, for sharing that. I asked this question. We talk a lot about the support that is needed, particularly in higher education institutions in this space. Some universities are trying to grapple with how they expand their support of students, faculty, and staff from Indigenous or Native American communities. In the past, they have been encouraged to engage in activities like developing land acknowledgments, like the one I sort of stumbled through at the opening of this call. And in a recent article in The Atlantic entitled "Land Acknowledgments Are Just Moral Exhibitionism." These statements relieve the speaker and the audience of the responsibility to think about Indigenous people, at least until the next public event. So in some ways, people go through that exercise, and then there's no other sustained or, there's no other accountability about how do we follow up, after we make these statements. So what are your thoughts on or suggestions for substantive ways universities can support these efforts beyond the land acknowledgement, which we talked about at the top of the hour was an important part of recognizing sacrifice. What else can universities do?
I'll let you go, Jen.
Okay.
Again, I think I come from this from a financial lens, but a lot of our tribes are understaffed. And you might say, well, you just said, Jen, that you have a very high unemployment. So how does that coincide? And sometimes we just have a lack of skills in particular areas. For me, at my tribe, we need more nurses. We need everybody. We need more people in healthcare. We need more people in engineers in public works. We need more people that have accounting and finance skills. And I think if there were some way to partner with, local universities, and maybe it's even community colleges, to kind of align the skills needed with those that, some kind of educational opportunities to sort of align those, so we don't have to outsource our accounting, and it costs us 10 times more than if we could grow our own people to be in these positions. So that's sort of my thoughts on it. And, giving us these opportunities to share our knowledge and our histories that aren't taught in schools. I'm just so grateful for this opportunity this evening.
Thanks, Jen. Joshua?
Yeah, so I like to think of myself as being in these spaces of leadership and stepping into positions that have historically been held by non-Indigenous people, that now stepping into these roles, it's a chance to speak and engage and to have a seat at that table or at that talking circle or at that fire, to really be part of active change. And so when I think about how we can go beyond that land acknowledgement of making ourselves feel good and looking good on websites and all that, is really thinking about action. And that's just part of that journey of on cultural competency and cultural humility. But there has to be steps in place at all levels, at our undergraduate students, our graduate training programs, and even at the department levels, where we evaluate ourselves and ask, is there diversity truly there? Are there plenty of opportunities for inclusivity? And if there's not, are we putting things into action? And that's that justice part of the diversity, equity, inclusion work that we need to always consider, is when it's not the way it is, how do we make sure we're providing opportunities for these? And so I think it starts by really looking at the role that anti-oppression and anti-racism frameworks and how those can fit into all sectors at institutions, business, public health, School of Medicine. How do we teach from this framework? And if we're going to prioritize diversity and inclusion, we have to be prepared to meet the needs of those students. Otherwise, we're setting them up to fail. Same way with communities. If we're doing it from a colonized lens of being the PI living outside of the community, or be living on the opposite end of the country and trying to conduct research and then calling it CBPR, that's not community-based participatory research. And I'll keep saying that every moment I get at Johns Hopkins talking engagements, is unless that community knows who you are, knows your ties, knows your beliefs and values, it's not CBPR. It's not community engagement. And so I want us to, again, take a step back and really think about these terms of decolonization. What does that mean? That requires you taking a stance and looking at how are your biases and stereotypes contributing to oppression, but also the communities and spaces in which you're a part of, how are those policies in place contributing to continued oppression? And that's what we often see in higher education, is we have that mentality of that need for independence and competition. And sometimes it's unavoidable. Someone that being like me, who's trying to push for more publications to be competitive, that's just there's no way around that, at least not right now. And so I get that part. but I think having more conversations like this, not just during Native Heritage Month, but throughout the year, talking in these anti-oppression work groups across the schools at Johns Hopkins, and taking time to step out of that competition in those roles to be an active listener and an active learner, because we're not quite there. When we have the director of the Center for American Indian Health and associate directors being non-Native, and these institutions that are centers that are serving mostly American Indian, that's a problem. We need to look and take a step back at how is this leadership, how is this infrastructure contributing to continued oppression? And so that gets at a sensitive subject sometimes of stepping into conversations about fragility, stepping into spaces of white saviorship. But that's all part of anti-racism, anti-oppression work, is being able to step into these spaces to have constructive conversations, to have a plan, to work together, to be collaborative. And so that's, and I'm saying this not just as a faculty member, I'm saying this as an Indigenous person who sees what's happening from the student side, but also on the faculty side. And so I invite everyone that's listening and your colleagues who you're going to go and share this with, and those that may listen to the recording, is that we really think about how can we have this conversation beyond this final day of Native American Heritage Month. How can, and also what are other opportunities to continue conversations with our brothers and sisters from the Black community and Latinx community, our refugee, seasonal migrant workers, and the list goes on and on. How do we keep and provide opportunities for those individuals to step into those leadership spaces, to be eligible for tenure, to be eligible for all these benefits that the main campus has? And so, again, it's an invitation, and I'm saying this from as a Diné and Pueblo man who sees the injustice continue. I see a lot of change and a lot of progression, but I still see that injustice. And so how do we move forward? And so this is my invitation to everyone to continue this conversation beyond tonight, and really think and put things into action, and to walk that talk, and in order, when you're giving those land acknowledgements, think about what that means. We are sometimes in occupied space. We're the occupiers, we're the settlers, we're the colonizers, or sometimes we're guests, like I am. I'm a guest on ancestral Sandia Tiwa lands along the Rio Grande River here in Albuquerque, New Mexico. And that's a constant thought on me, is I'm a guest here. How do I maintain and make sure I'm still welcomed here? And I think that is how we start to think about connections and the importance that those connections are as a higher institution of education and learning, and the communities that we're trying to serve.
Thank you so much. Thank you both. We have about a minute or so left. I just want to remind our audience that we are going to disconnect, take a 5-minute break, and we're going to come back and have an opportunity for us to discuss ways that we can do exactly what our panelists have talked about. You know, how do we build collaboration, connection? How do we do the sort of introspection and work that you just talked about that needs to be done by allies and advocates to move beyond sort of the perfunctory allyship that some folks engage in? You talked about our Johns Hopkins Center for American Indian Health. How do we support the excellent work that those colleagues and faculty and students and postdocs, learners and scholars are engaged in? We have an asset in them on our campus. So how do we work with them? How do we support the work that they continue to do? They keep pushing and advocating, but they shouldn't be alone. They need partnership in that space. And so, you know, how do we continue to do that? Jen also shared this idea of grow your own. And so that you don't have to rely on other folks, right? It's not that we don't want to build community, but we ought to be able to have the capacity in our own spaces to be able to do what's necessary to continue the work. So I know we only have 1 minute left. I would love for us to sort of end this with, what are you most proud of? In 1 or 2 sentences, if each of you can share what you're most proud of about your community and culture. Jen, you go first.
I think I'm most proud of our our ability to come together and support each other. Whether that is something big like the COVID pandemic and seeing our high school football team deliver care baskets to COVID positives, or, just small things, our ability to come together and support each other, and especially in a time of need. I'm really proud of that for our people.
Thank you, Joshua.
I want to just echo this exact same thing too, of community empowerment and people, and just this concept of kinship. That's what I feel like we saw during the pandemic, of youth stepping up, community members stepping up, and everyone lending a hand to help. And that the reason why we have had high vaccination rates across Indian country, and the reason we've been able to keep numbers low in many of these communities is that respect for one another. That concept of, in Navajo language, that means kinship, and that's the reason why we've been so successful. And I think the rest of the world has a lot to learn from Indigenous communities, but it starts just there: respect for one another and community. And that's
Thank you
something
so
I'm very
much.
proud of.
Thank you
Be
so
a good
much.
relative.
Yeah, absolutely. So thank you so much to our panelists for speaking so openly about their thoughts and experiences. We're so grateful. Now we would like to engage everyone in a conversation to share and listen, and ask questions, right? Provide solutions. We'll have a 5-minute intermission, so we'll come back at 7. And during that time, we hope that you will join us at 7:37, and our panelists on Zoom for small breakouts. This evening, a special thanks to those of us who are behind the scenes who've helped. Be well, stay safe, and enjoy the rest of your evening or day, wherever you may be in the world. Thanks, everyone.